Hello, everyone, and welcome to our final chapter in our final week of exercise physiology, kinesiology 406 for the spring term at Concordia. We're going to be talking about obesity, diabetes, and physical activity, and some final thoughts going into our final days here together. Before we get into that, talking about heart disease, our last chapter with cardiovascular activity and cardiovascular disease and physical activity. Talking about a few terms I want to make sure we clarify before we move on. Talking about pathophysiology in defining the difference between pathology, which is the science of cause and effect of disease, physiology, which we're doing exercise physiology, right? Or we're covering exercise physiology. Physiology is a branch of biology that deals directly with living organisms and their functions, whereas exercise physiology deals with physiological effects during what's going on physiologically during and after exercise, right? And of course, the pathophysiology is the study of how physical activity may affect disease and dysfunction. We mentioned before or talked before about some of you probably will be teachers, some will be athletic trainers, some possibly in the medical field, either nursing or medical field of some other aspect, possibly dietitians. I don't remember there being very many of you, if any of you were interested in that per se. I know at least a couple of you have done some personal training. But that being said, having both understanding of exercise physiology as well as how it affects us pathophysiologically, from the standpoint of how it affects disease and dysfunction, makes us better as athletic trainers, teachers, potentially medical field, or personal trainers and coaches, right? I don't think we have to be stretching too far to know the difference there. That said, the pathophysiology, or to recognize the importance there, I should say. The pathophysiology of coronary heart disease, also referred to as coronary artery disease, as we mentioned before. Atherosclerosis basically develops due to damage to the endothelial cells of the coronary artery. That causes the plaque and lipids to form and or could be or free radical damage to the sites from any form of stress. Smoking is one of the most common ones. That's very significant effect there. But any form of poor nutrition and low level of activity will play a role with that as well, with free radical damage, stress as it relates to life stress that may not be handled as well because you don't have the ability to fight off the stress well. So you see the negative effects more prevalently, more chronically, and possibly more acutely. And of course, the increased blood concentrations of very low density lipoprotein. Your book was making note of the difference between what we refer to as low density lipoprotein for the artery clogging agents, clotting agents, I should say. And then that being said, you can also have what's referred to as very low density lipoprotein, which is even of greater concern in people who have issues with extreme plaque buildup and risk from heart disease or having had a stroke or heart attack or some more aspect of coronary heart disease or atherosclerosis. They are very likely to have a high level of this VLDL differentiation between our typical LDL. Okay? There is an unfortunate association given too much toward LDL by itself as being the cause of heart disease and being the primary concern, whereas as we mentioned before, the bigger issue is your HDL to LDL ratio or your LDL to total cholesterol ratio, which is still a relationship of how much HDL you have relative to your LDL. We don't want that HDL to be less than 5 times the amount of your LDL. That's where it gets to be concerned, right? A real significant concern. 3 is probably a better ratio. That being said, excuse me, our goal for exercise physiology, we've kind of mentioned it in the last slide as well, is to increase your HDL, which will happen with regular activity. Your nutrition can to some extent play a role with increased HDL, but not as much as exercise can. Prescription drugs can't do as much. Nothing increases HDL like activity does. Okay, an increased left ventricular size and wall thickness, that doesn't happen without primarily exercise. Again, your nutrition and other factors will play a role in supporting the exercise, but the exercise plays the greatest role in change, and you can't have hypertrophy and muscle growth of any kind without significant activity to a positive extent. And that being said, increased stroke volume, along with the regular activity, engaging the heart from the standpoint of enough activity stress-wise to benefit, and we want to be always cautious in overtraining, not overtraining or causing someone to overreach. And I mentioned in I think our last PowerPoint, and certainly was in the book, and I threw it out to a couple of you in your discussion board post, was discussion of Ryan Shea, the endurance athlete who only 10K, 6 miles in-ish to a marathon and is like very young, in 20s essentially, basically died of a heart attack. and that shouldn't happen for an extreme endurance athlete. And there are some who will say it was due to some unknown, as yet unknown, genetic predisposition toward having heart disease, and that's highly possible because it's not normal to have someone have a heart attack necessarily who is of a high level endurance capacity, which means that you'd expect to be having all sorts of the parameters that are there for protecting one from heart disease. However, the independent factor there that's hard to say without following someone all the way along is the potential for overtraining. And that's where I tend to be leaning toward. I don't disagree with the idea that genetic predisposition toward heart disease was probably there for him and is often the case. However, something has to trigger that. Just because you have a disposition toward anything does not mean that that is where you automatically go. And we'll talk about it here shortly with obesity and being overweight and really any issue someone has. It becomes very difficult at times when you're determined to have had expected limitation based upon your genetic predisposition in some way. Can become a limiting factor, or it can be something that you use as motivation. And that's what we have to really be careful about, because it could be easy to simply say, I have a genetic predisposition toward heart disease. I don't want to work too hard and get too much stress at anything, including exercise, so I probably won't do too much there, when in fact that could actually really be helping you. Likewise, when people are obese, they have similar issues whereby that's just me. Everybody in my family has always been overweight. It's always been an issue for us, and so consequently, I don't see the point of exercising because it's just going to be there, when that's not necessarily the case. And like so many things, we talked about it with muscle fiber typing, with type 1 versus type 2A versus type 2X. You can do a muscle biopsy, and you can determine someone's breakdown of muscle fiber type currently right now in their quadricep or a different muscle in the body. That doesn't necessarily tell you specifically what level of performance someone's going to be. It can give you tendencies, it can give you probabilities. It does not fully determine it. And that is the key factor to understand in not allowing predisposition toward heart disease, or in this case for this chapter as well, obesity or being overweight, to be a limiting factor in keeping us from trying to do something about that. It puts people at a higher level of effort needed, unfortunately. Puts them farther back, right? A lot more work to be done to get yourself to a healthful place so the person doesn't have that same challenge. No question about it. We have to be cognizant of that, but not accept it. It's not the same thing, okay? And that said, of course, too, regular cardiovascular activity, basically for a standpoint of physiologically helping someone avoid heart disease or deal with it. You get increased dilation or capacity, size, elasticity of your blood vessels, let alone the heart, and of course improved flow of oxygen and nutrients to the tissues, which is of monstrous importance for overall health and avoidance of potential future heart disease. And of course, blood pressure, hypertension. The book mentioned it. We mentioned it briefly as well. It's difficult to determine whether it's specific toward activity or specific towards someone's genetic background. No question about it. Predisposition again will be a problem to some extent. However, it does not end up having to be the primary factor. Life stressor issues are more of a great issue from a standpoint of what chronic stressors are we engaging every day on a regular basis. How is your sleep? How is your nutrition? How is your exercise? And of course, your lifestyle stress. Please, in all the days and years and months, years and so on beyond this course, don't forget that big four. When we talk about your possibilities you can alter or have an effect upon to improve your overall wellness, health, not just benefit from exercise itself. Exercise is one factor, and in many ways, potentially the most significant factor for how you help you deal with stress. Although lifestyle factors are a big component of that, what's going on in your life, sleep and nutrition, those big four. If we want to give 100%, that would be 25%, 25%, 25%, 25%. Not that it's an exact science, but your recognition that you have four major parts to be looking at, the whole picture, not just one part. And then the goal for hypertension or blood pressure is using exercise to increase the capacity to handle stress or to lower it. And remember, we talked before about moderate intensity exercise is the best for helping someone lower stress levels, lower cortisol levels, somewhere in that 40 to 60% VO2 max range. It could be lower, could be as low as 30% VO2 max, not higher than 60% VO2 max from a standpoint of that you're getting closer toward high intensity. Certainly, the person who could actually be at 60% on a light day when they need to be lowering stress for any reason whatsoever is the person who already has significant cardiovascular conditioning, right? The person who should be at 40% is either the person who has high cardiovascular conditioning and is having a particularly stressful time right now, or just the person who has no significant background in cardiovascular training and does not have a high capacity VO2 max lactate threshold. They should be closer to the 40%, maybe even the 30% of VO2 max, which puts your heart rate range from 30-40% VO2 max to somewhere around 50-55% max heart rate, give or take. And then for the 60%, you're going up closer to 75% of max heart rate, okay? Generally speaking, very general. That being said, overweight versus being obese. Overweight meaning, when we refer to someone being overweight, they're exceeding normal standards for weight based on height. Now, we mentioned it last section or last video that weight by itself or body mass by itself is not the only factor of significance and importance. However, it's a big one, and it plays a role both in how we see ourselves, how we perceive things to be affecting us, and how they actually do affect us from the standpoint of the difficulties that we face with being bigger, right? It's not necessarily a bad thing by itself, but it may potentially lead to other things. Obesity is an excessive amount of body fat, right? And then that being said, we'll talk about levels of obesity a little bit too, but obesity is beyond overweight, right? BMI, when we refer to BMI, is one of the easier methods for kind of categorizing people as being overweight or obese, again, dependent upon their background, their body structure size, whether they're more of an athlete who tends to be bigger or someone who's inactive will play some role here, but just understand that the numbers in general mean the higher you go in the BMI, the more stress there is on your body. Even when we have more muscle than fat compared to someone else with a similar BMI, there is still more stress. You're carrying around a larger weight all the time by 10, 20, 30, 40, 50, 60, whatever pounds more than someone else might be. Over time, that plays a role in stress in challenging the heart to deliver more blood on a regular basis, the blood pressure to be typically higher, and all those things do play a role. We don't typically see larger people living long lives. They can, they do, but it's not typical, right? Underweight. Someone under 18.5, that's a very low BMI. When you take someone's height in meters and square it and divide that by someone's weight in kilograms, that's a very low number. And that's concerning from a standpoint of many health parameters, maybe pushing toward the potential for being anorexic or bulimic or having some sort of eating disorder potentially. Certainly not a good place to be. Being normal is somewhere pretty broad range, 18.5 to 24.9. I think for my weight, for my height, basically at 6 foot now, of course, as I mentioned before, little loss in height, could be closer to 5'11 now, with compression of discs and whatnot over time at now 49 years old. For me to get 24.9, I basically have to get my weight in the 170s, which is pretty low down there. And I'm going to challenge whether that's for my particular bone structure and knowing me my whole life, that's pretty low. And I would argue that's actually potentially not so much underweight, but I could probably be more closer to 26 or above and not be a big deal BMI wise. That being said, that's at least somewhat subjective. These are general numbers, right? I'm not worried about exactness here, whether 25 or 24.9. But when you're close to a range, then if you're normal, high end of normal, close to overweight, we have to look at a lot of different parameters. If you're not just overweight, but closer to obese, we have to look at a lot more parameters more closely, right? Risk just goes up. That's it. That said, being obese, 30 to 35, and then being even morbidly obese, being 35, and your mortality rates increase dramatically if you're above 35, okay? Extreme obesity, of course, being 40 or greater. And the parameters are pretty clear on that one. When someone's extremely obese, the likelihood of someone living a long life are not high, right? Now, according to these standards, in 2008, 72% of the U.S. men, 64% of the women were overweight, and 32% of the men and 36% of the women were obese. About a third obese, close to 2/3 overweight. Okay, don't think it's changed a lot. It's changed a little bit. There's some numbers that have come up in the last few years, but not a huge change, not a dramatic change there. As of 2008, so a little over 10 years ago, 6 to 19-year-olds were overweight. There was only 5 to 7% in 1980. And I'm thinking you're going to see some very similar numbers, perhaps even worse now if they took a 2019, 2020 broad-ranging research study. That being said, I'm sure we can find more. If we look a little deeper, we can find some more studies out there. They're out there, but are they looking at enough population to give us a better idea what's going on? That said, 1980 versus 2008, so almost 30 years difference. The biggest difference, unquestionably, is, shocker, lack of this physical activity. Unquestionable. Has the prevalence of fast food and other foods become more accessible and prevalent? Yes. Is it significant? Do we have fast food that was pretty bad in the 80s? Yes, we did. I don't think that it's that dramatically different to justify that much of a difference. The biggest difference is, to be really clear, it's all the video games. And it's not that video games are bad. Heck, I play video games. I think they're a lot of fun. But that's kind of the point. They're so good, they make people want to just play those games. And they want, and getting on your computer, and we can look up anything from a computer. We don't have to go anywhere. We don't have to go walk to the library or get on a bike and ride somewhere. We drive in our cars everywhere, and we can access things mostly from home if we wanted to. Almost anything. Here we are doing our class at home, right? Couldn't have done that. At least effectively. Could have done it, but it would have been having some real issues a little over 10 years ago. It could have happened, but it would have been challenging. Okay, right? But that being said, there's no question about it. There is a lot higher prevalence toward lack of physical activity. No one will ever question the need for better nutrition for anyone. However, it's a lack of physical activity. There's the biggest parameter, the most significant parameter in people who are overweight, obese, have diabetes, okay, and heart attacks. That's the most prevalent factor for all of them. Okay, there are very few instances where someone is significantly active on a regular basis without going crazy and overdoing it that has those issues. They exist, but there aren't many. Okay. That being said, the problem with changing weight and body fat. The body fights to maintain its weight and body fat for quite a while. There was some studies their textbook was talking about whereby they were studying rats, and whenever they put them on a low-calorie diet for a few months, then bring them back to normal diet, even a little bit, they would quickly go back to their normal weight, quickly. It was when they had them pursuing a diet of any kind for 6 months or more that the set point was able to be maintained much, much easier, and much more likely the person would not, or the rat in this case, would not return to the previous weight prior to any sort of change in diet, let alone exercise program. That seems to be prevalent in humans as well. I've always seen research referring to about a 4 to 6 month time frame whereby that's the expectation of engaging in significant, consistent, regular habits. If you want to be looking at the whole person, lowering your life stress, getting better sleep and more sleep, eating better, and of course exercising more regularly and more appropriately. If we do the quad there of all four things really, really well, the probability in 6 months of us being anywhere near the same person are highly unlikely. Okay. That being said, how difficult is that? I don't know if you've ever tried, and you're all pretty young. You probably had a lot of instances where you've had a lot of fluctuation from 40, 30, 40, 50 plus pounds one direction or another. Maybe you have, but most people have not this early in their lives. It typically comes more in the mid 20s to the early 30s, and then fluctuates a little bit here and there, and then starts to hit another level as people get their 35s and 40s, 35 to 40 and a little above there, and keeps getting new levels of, just like the predisposition towards someone being genetically obese, or genetic predisposition toward being obese, or someone having more of a prevalence toward heart disease. As you age, you simply have to be more consistent. You have to be more regular with what you do to avoid the ill effects that come with aging, right? And that's true also from a standpoint of you must be more consistent for longer periods if you want to see a significant change in your set point. The body is really smart. The body realizes or decides that if you engage in any sort of significant physical activity for a few weeks or 2 or 3 months, this is a stressful time for you. This is not you. We need to get you back and bring you back to your normal. Got to get back to your normal resting metabolic rate, bring you back to normal weight. We're going to get you there. Don't worry. We will take care of you and get you back. But your body's telling you. It's only after about 6 months the body seems to kind of go somewhere in that 4 to 6 month time frame. Body starts to go, oh, okay, this is you now. This is you. We have to actually adjust hormonally. We have to adjust nervous system wise. We have to adjust from a standpoint of hypertrophy. All these different adjustments are made internally that all play a role cumulatively to create a different person in a few months. But it has to be consistent enough for that actually can happen. Okay? And that's one of the biggest problems with many programs. They don't go for long enough, or they don't create a overall atmosphere or environment that makes people likely to follow for that long. It's one of our greatest challenges in health and wellness and fitness and performance is trying to keep people going at something long enough to see the benefit rather than saying, hey, that didn't work. That's tough. It's a tough one. That said, something that can help us with understanding kind of what's going on metabolically. There are three components to daily energy expended. There's a resting metabolic rate, expected to be about 60 to 75% of your total metabolic rate. Long-term behaviors play a big role with this from the standpoint of what you do consistently for a long period, how you eat, your lifestyle stress, how you exercise, how much sleep you get. Add those things up over months and months and years, you come up with a totally different person. Your resting metabolic rate changes dramatically. It takes a long time, probably 4 to 6 months, to change your resting metabolic rate for it to be more likely to stay, assuming you're staying at a similar level for 4 to 6 months, right? If you're not consistent during that 4 to 6 months, it's going to take longer. When we say consistent, is there exactness here? No, but that's what we talk about 3 days being a good minimum standard. If you want anything to even happen slightly, you better be going 3 days a week with some really regular positive behaviors, not just exercise-wise, with everything. The closer you get to 7, the more likely this stuff happens. The more likely this stuff happens faster. The more likely everything sticks from a positive performance parameter. And then the thermic effect of a meal, what you eat right now, it's only about 10% change. Like some people try to eat spicy food and do something that's going to adapt their metabolism significantly for just what they eat right now. That doesn't have a significant factor more than about 10%, the very, very most. Everything that goes on from the time you eat it to the time you excrete what you don't use is a 10% of your metabolism. It's not overly significant. Is it important? Oh, yes, but not as important as the other factors here for expectation of body weight changes, right? That being said, thermic effective activity, or TEA, you're basically talking about 15 to 30% of your metabolism, of your overall energy expended and used. That being said, if you're closer to 30%, whereby you're engaging in about as much as your body is reasonably going to be able to handle without overdoing it, then you're going to be expecting a whole different you, 30% versus that 15%, right? And those thermic and metabolic changes due to digestion, absorption, transport, metabolism, and storage, they're all temporary, right? The only activity that creates any lasting changes here is exercise, okay? That's right here, thermic effective activity, okay? Concerns with chronic overweight or obese issues, genetics do play a role. That requires, again, more or less effort to maintain healthy weight. It is not a sentence once you've gotten that gene. And I know people who I have extended family with. My family, I'm adopted, so I don't really know my background in terms of what my predisposition is toward. That being said, I know people around me and I can see it, predominantly their family. Part of it's lifestyle factors. When you're around people enough, you tend to adopt their lifestyle factors. One of the reasons why we're often told, if we're going to be successful at anything, to hang out around successful people, to be with those people. If you want to be good at something, be hanging around those people that are good at that thing. And of course, the problem is what happens to a lot of people, they tend to take on too many other behaviors which are not consistent with what they're seeking. So in other words, they may go hang out with someone because that person's fit, but then again, they start taking on their behaviors and how they deal with other people, as opposed to just the physical component. It's not everything to do with the person. One of the hardest things for us to do when we see someone who's successful at something is to disseminate the difference between the things that made them successful and the things that they just succeed in spite of. It's in spite of. There are a lot of those. Most people made far more mistakes than they have successes to get to where they are in anything. And the hard part is finding the things that made them successful, not following everything they did, or we might end up having far less success than they did because we're not genetically made the same way. We don't travel the same path over many months and years that they do. We just don't, right? There's no such thing as a naturally high metabolism. There just isn't. You cannot sit on your tail, sit right there in your chair like I am right now, and not perform activity for months and expect that you're going to maintain the same metabolism. I gave that same example so many times about me in sophomore year of college getting hurt in Thanksgiving, and by the time I got to the end of January, and I was a regular runner. I ran several days a week for years and years and years and years, collegiate track athlete, and yet I gained 20 pounds in 2 months because I didn't change my diet, ate the same diet, and my activity level was way down. My metabolism will change dramatically with a lack of activity. Nothing changes as fast. Nothing has as much of an impact in a positive way as fast. That said, You could probably argue prescription drugs. There's no question about it. Drugs can do things that you just can't otherwise do, but that comes with risks, right? And are those lasting things that can be reasonably taken for lengthy periods? Something to be decided between you and your doctor if that's a field you choose to go into. But ultimately, we want to do what we can to control for the controllables that are within us, first and foremost. That said, hormonal imbalances and emotional trauma play a role. There's no question about it. From the standpoint of the myriad of different hormonal responses, specifically we refer predominantly to cortisol and the cortisol's responses and epinephrine during times of sympathetic nervous system activation. One of the biggest problems for people who have high stress is they have that sympathetic nervous system firing up on a regular basis. It's really hard for the body to get rest, really hard for the body to recover from anything. So consequently, we have chronic inflammation, chronic likelihood or increased likelihood of increasing weight, built up of plaque, all sorts of things that go on there. That's why it's such a big deal when people talk about hormonal balances. The regular activity component plays a huge role in helping balance out that concern. Okay? That's what we talk about, that low and moderate intensity, not high intensity exercise. Environmental habits, such as cultural habits, are significant, though, and have to be understood that certain people are going to be more likely to eat certain foods because of their background ethnicity-wise, what their family eats, and they can't just shun their family. I remember seeing one of my more unique moments watching TV with some of these reality shows that I rarely watch because I don't like them. They bother me most of the time because it's made for TV as opposed to what real life is necessarily really like, even though they try to simulate some things to their the benefit that are to actually give them the benefit of the doubt. It's hard to simulate everything. That being said, I remember one Biggest Loser episode whereby one gentleman basically didn't want to go home. He was the finalist, one of two people. And if he came back after a month or 3 weeks, whatever it was, and he had the best weight loss, then he would win the whole thing, win the $250,000, right? That being said, that guy did not want to go home. He wanted to stay at the facility, and the trainer, Bob, came in and said, "What are you doing here? You got to go home." He said, "I don't want to go home because I'm going to go home. I'm going to be getting there." They show this video of the family, and I'm going to come home and they're all sitting there eating fast food and eating junk food and not eating well, sitting there watching TV. That's all they do. So if I go, this new me now that I've actually started to work on being here for the last few weeks, like they probably was months for them. Uh, I'm going to go home and I don't want to sit there and watch TV, and I don't eat the food they eat. So that means I'm just have to not be there with them. That's all they do. And how's it going to change my relationship with them? And people don't give enough credence toward this. When you ask someone to make big changes, one of the most important questions is that reasonable based upon the lifestyle you lead with the people you're around? If not, we need to make some small changes and expect a much longer duration of change over time, not to change the world overnight, because it's going to change everything, including who you associate with. And that said, exercise and diet obviously are two of the greater controls, with exercise having the greater long-term effect because it's the only one that actually can increase your metabolism. It does not. Some people will read this stuff or they hear this discussion and they think nutrition's not important, or they say, you're saying nutrition's not important. Not at all, but it supports the metabolism. It doesn't change it for the better. It doesn't increase it. It just gets you to normal. That being said, morbidity versus mortality. Morbidity is the presence or rates of presence of particular disease. Mortality is the deaths or rates of death related to the presence of a disease. And that said, generally, you're low risk, your BMI is below 30. Your moderate risk, between 30 to 40. Okay? Your high risk when you're 40 above. Okay? When I say moderate risk, it means dependent upon other factors, right? Low risk, probability of you having a significant near mortality. This means near mortality, right? That alone by body weight is not likely to be an issue. When you get here, it's more of an issue. Here, it becomes really concerning about how long you really have when your BMI is that high, right? And 34% of all adults in the US have metabolic syndrome, which is pre-hypertension, which means between 120 to 140 or for systolic, 80 to 90 of the diastolic. High blood sugars, which means their blood sugars are above 125 milligrams per deciliter. Remember, you take a blood glucose test with an 8 or 12-hour fast, and if your blood glucose levels are consistently, after many tests like that, are above 125, you're potentially hyperglycemic. Okay? And a doctor will be the one who will decide if you're hyperglycemic or not. I actually had my dad who had actually been bitten by a snake, okay, bitten by a rattlesnake, and then a few months later came up with acute myeloid leukemia, AML, which can be a death sentence for some. Luckily, he had genetic markers. Excuse me. Luckily, he had genetic markers for being able to take a certain new experimental drug, and he got through it. He went through it like with flying colors, and all of a sudden he seemed to be well, and he is well to this day, to make that clear. But basically, got through it really fast. And that was really unusual. And that being said, during that time, it affected his blood sugar. He survived, fantastic, right? Good news there. That being said, a lot of things going on there. Leukemia and a snake bite within a year. That being said, his blood sugar levels were like 130, and he's one of the doctors he was going to said, after testing him one time, by the way, his 130 test, I'm going to put you on medication. He told me, and I said, Dad, I want you to go see somebody else. That's only one test. They should look at you numerous times where they make the determination to put you on medication for diabetes. I said, do they tell you there's some other extenuating factor here? That's always something you got to be considering. There's something else that someone's not telling you. You don't want to assume. This is so true of anything, right? It's true if someone asks you about a class, about your friend, someone asks you about something going on at work somewhere. Don't just pull apart the things you want to talk about. Look at everything and decide ultimately with everything, the risks, the benefits, the good, the bad, the concerns, the things that are going well. We can't just isolate single things and allow that to affect us. We form opinions and perspectives too easily in that regard. That said, the one doctor saw one number one time and said, I want to put you on medication. I had to go see another doctor and the doctor said, no, not yet. Let's do a few more tests. Tested him over the course of a few weeks. Blood sugars were going down. They said, don't worry about it. You're fine. We'll keep testing you every few months here when you come back in next time. Make sure, or let me know if things come up, but I think you're okay. Didn't put him on medication because they allowed the process to be what it was, which was to make sure to be what it should be, to assess numerous times to ensure the result is accurate, not just a random response in terms of stress, immediate current stress, or any other factors that are unknown. You got to give it more time before you put someone on medication, right? Don't want someone to go in there right off the bat with high blood pressure one time and say, here's medication. I don't do that either. High cholesterol, high triglycerides, leads to high probability of heart disease, and more the LDL, more the VLDL in particular, that's an issue there. Triglycerides is stored fat, particularly the visceral fat. It's a big deal around the waist, whereby probably the greatest concern exists when it relates to weight and obesity. And that said, diabetes, blood sugar wise, your body becomes more insulin resistant when the insulin you secrete just can't do its job properly. That happens due to numerous hormonal imbalances due to a lack of activity, poor nutrition, high stress, you name it, right? And of course, weight being a big issue with that. And the question in most cases, research would tell you it's not the weight that caused it, it's that you have all these bad behaviors and you end up also being overweight. So when someone's overweight, the assumption's often made, you must have a lot of poor behaviors that got you to here, which is why we expect to see some of these other effects, these metabolic syndrome effects. But that's not necessarily the case. That said, how do you improve insulin sensitivity? With regular activity. Insulin has been shown to be much more productive in its own usage, its own, not so much necessarily more secretion, it's the same amounts, but it does its job better. It helps glucose cross that cell membrane more effectively when you're insulin sensitive, related to better activities, lower stress, as opposed to the other way around. And of course, stroke, incidence of having basically a blockage of somehow it's affecting the cerebral artery, whereby you actually can have paralysis and effects with speech and other obviously traumatic effects, which we don't want to see be the case either, which are prevalent with people who are overweight and then start to have other symptoms. Sleep apnea is a big deal for people who are overweight, which isn't terribly surprising. When you're someone really big, your body has to work harder, right, to pump blood. The heart has to work harder to pump blood, so it certainly requires more work internally to help deliver oxygen and nutrients to tissues and to your body. Breathing-wise, potentially, for talking about a lot of body size and body weight, you have to take in bigger breaths to be able to give your body what it needs. But certainly, sleep apnea can be related to issues with nasal passages. It can be a relationship to simply being overweight and having poor cardiovascular health. And that is one of the biggest factors. Whenever I hear about someone having sleep apnea, first thing I often ask them is, do you engage in regular cardiovascular activity? And 9 times out of 10, they do not. It's a big factor. Like all things, should they still potentially be taking prescription drugs? That's the doctor has to decide. Unless you're the medical doctor, we don't decide that. But that being said, more importantly for the short term and the long term, they have to be engaging regular exercise. Osteoarthritis is also common with people who are overweight and obese. Rheumatoid arthritis is a hormonal thing, okay? And whereas osteoarthritis is more specifically to with a particular joint or area that you've overused. And if you think about it, not terribly surprising, why do a lot of people who are overweight have issues with knees and backs? It's a lot of stress on your body on a regular basis, right? Android versus gynoid obesity. Men tend toward android obesity, upper body fat storage, more like an apple, right? And women tend to be more toward gynoid obesity, more toward the hips of the thighs where fat tends to be stored, more like a pear. You hear those analogies sometimes. It tends to be more genetically where we're predisposed. It's also going to be more likely, be more clear, you're going to be more like the apple type if you have a lot more prevalence of testosterone, right? A lot higher prevalence of estrogen, the more pear-like the person is going to be, okay? More of a hormonal differences there too, not just related to activity, which will also play a role, as we mentioned before, and differences between men versus women. Those factors can change, all dependent upon numerous factors individually, specifically also in terms of muscle mass and genetic predisposition toward more muscle mass, right? The waist hip ratio we talked about, at least I think I talked about, but you don't want to be more than a 1-to-1 ratio. Waist size to hips. Basically, we say hips. Some people will say the largest part of your hips, amidst that area there, and the largest part of your waist. Well, we like to be more consistent with the belly button for your waist and one hand breadth below your belly button, your right hand, put your thumb right below your belly button, wherever your pinky is, put the tape measure right over there, and that's your hips. And that being said, if the ratio is from the waist to the hip is 0.9 or greater for a man, that's concerning. There's definitely an issue of overweight and potentially obese or borderline obesity, right? Whereas women, 0.85, lower standard there, expectation there for the waist to hip ratio. There's no question that that is possibly the greatest factor for recognizing more immediate risk for someone. Now, exercise as treatment for obesity, EPOC. Many people talk about how exercise should be of significant enough intensity that you have a higher EPOC following your activity, when it needs to be understood that has nothing to do with it. The benefit of the activity comes from your ability to recover from the activity. The benefit from the activity does not come from the significant high heart rate you have all day long. The best athletes will always have the fastest recovering heart rate. The people who engage in proper warming up and cooling down at the right intensity of their training sessions will always have a faster return toward normal with their heart rates, with more efficient, normalized body responses in the immediacy following the training session, within 60 minutes following the training session, okay? Whereas if you have a high heart rate all day long and you feel like you're still racing, that's not a good thing. That's overstated the benefit or the effect of exercise post-oxygen consumption from a standpoint of overall health and well-being for people, okay? There's nothing wrong with somebody working hard, but you want to be able to recover from it, and that is key. Aerobic activity in obesity treatment research. In a 1-year study where 3 times a week, 30 to 45 minutes per day, 55 to 75% VO2 max, moderate to maybe low end of high intensity, is basically they found that people had a 7-pound weight loss, 11-pound fat loss, 4-pound muscle gain in a year. Okay, and that's the only thing they did differently. 3 times a week, 30 to 45 minutes exercise, and that percent VO2 max. That being said, if you just ate the way you know, what we don't really see there, did they eat exactly the same way? In my experience and what we've seen in the research, when people engage in a little bit of activity and don't make it a consistent thing, only 3 times a week is less than half your week. And that's a minimum standard for just basic health. To be really clear, what we typically refer to with 3 times a week, that's health. You're not going to be expecting great body changes with only 3 times per week. Can you imagine what that's going to look like if it's 6 times per week? It's not going to double. It's going to triple or more. Okay? You don't, just because you double the time, you get far more benefits. You don't just get double the benefits. It's not going to be 14-pound weight loss and 22-pound fat loss and 8-pound muscle gain. It's going to be more like 21-pound weight loss, about 33-pound fat loss, and about 12-pound muscle gain. That's monstrous. That may only be 21 pounds, you think, but when you see that person, considering that's 33 pounds of fat, with a 12-pound muscle gain, that's significantly they'll look like they're 40, 50 pounds lighter. Okay, that's how dramatic it will be. And that's only exercise. The consistency and regularity of activity is much more important uh, to be looking at from a greater perspective of more days per week, first and foremost. Then you look at the intensity and so on. Down the road, performance is your goal. You got to work on the higher intensities. But just to get the health parameters, the more frequency is far more important. Okay. Expected weight loss after 6 months. This study, same study there, basically with 3.5 pounds was after 6 months, with 70% retention after 1 year by engaging in exercise. Basically, they were able to retain that that level of weight loss. And then behavior modification only weight loss, 22.9 pounds, and they kept most of that. Okay, behavior modification only. Now, I mean, change some behaviors and things you tend to do, your stresses, and some extent how you look at food, looking at things really, really closely, and like how you're looking at things. That they didn't say specifically whether you exercised at all, nutrition-wise, but you had to change those things. So you eat the same things and don't exercise and lose 23 pounds. Unlikely, but that could also refer to smoking and drinking. So that plays a big role. Better believe that. Okay. That said, low calorie diet, 51.6 pounds. Someone just ate a lot less, with only 25% retention after 1 year, though. Probability of someone retaining their weight change from eating little is highly unlikely, as we talked about before, because it lowers your metabolism. When you eat little, you lower the metabolism. You lower the metabolism, you lower your capacity to be able to handle stress. The probability of the weight returning is high, very high. That was a low-calorie diet for a year. When you talk about low-calorie diets for a couple, 2, 3, 4 months, 4 or 5 months, the retention rate is almost getting 90%, 80, 90%. The probability of returning to your normal weight is 80, 90%. The probability of you retaining your weight loss is 10 to 20% at the most. Okay. And what we obviously want to be doing is all three of these things, right? People like only. How about we try all three? And the hard part is, and your book notes it too, that the lifestyle strategies and lifestyle behavior modification for affecting your exercise and how you look at things and your other choices in life, smoking, drinking, and life stress as a whole, and how you eat, just telling people to set those things up for them, it's often doesn't work. Well, there needs to be a support system in place too. You can't just say, here's a plan, follow it, and send someone on their way. They need to have regular, consistent support from someone, some specialist, and it's often the specialist themselves, whoever it might be, medical field or otherwise, okay? Athletic field, dietitians, coaches, personal trainers, you name it, okay? Any one of them, if they are consistently more regularly keeping contact and doing anything and everything they can to adjust to the person to help keep them on task on a more regular and consistent basis, the more contacts, the better, the more likelihood of someone making these changes. As a personal trainer, anecdotally, it's anecdotal research when it's just you. I had 2 different clients that were 7 days a week. They paid me to train them 7 days a week. And their responses in a few months was they basically said to me, one was a 55-year-old, 56-year-old, one was in his upper 30s. Both of them said in the 6 months that that's the best shape they've ever been in their life, and not just in their life, but that this is the first time that they felt like they could keep it going. And it felt like it's just a part of them, it's who they are. And it took that regular activity every day the week to help them to recognize this is something I can't do part-time. It's not a part-time job, it's a full-time job. The reality is a lot of people think work is something you do, family is something that's important. Those are both very true, right? But that exercise is something you do if you can. Like, well, this whole thing you got, this body here is more than just, again, the brain and the hands. So you kind of need to use it for more than that. And if you don't, it's not going to treat you well. It's pretty much as simple as that, right? Simple and yet not. That said, regular exercise affects appetite. Why, this one you hear a lot. Want to eat more if I exercise? Yes, in the short term. That will go away. That will dwindle. That will decline. That need to eat more only lasts during the first few days, first few weeks, even couple weeks. The more regular someone is with exercise, the more this will normalize quickly. The more they exercise don't, like every other day exercise, the longer this is going to take. probably weeks, several weeks before they come to a more normalized response. Oh, I've had people absolutely tell me after taking your classes or your boot camp or training with you, yeah, actually personal training, I haven't had people say it. People taking my group classes though, my boot camp classes, they've said, after I stopped taking boot camp class, I lost a lot more weight because I know what it was. And I talked to them a little more extent. They weren't eating as much now. They stopped eating. If you stop eating, you will lose weight. And here's the kicker with that. If you stop eating, don't eat much, and you can actually maintain that eating very little, you can maintain your weight. It doesn't mean you're maintaining your health. It's not the same thing, right? Weight, sure. But that's the whole reason why I won't tell people, by the way, just because they lost some weight, I won't say. You can call me callous if you want. I won't say, you look great. No, I don't. I want to reinforce that. I don't know yet if it's because you stopped eating is why you're losing weight. I'll say, I'm really happy for you. I'll say that. Say, what are you doing? I want to ask them what they're doing before I tell them, great. I stopped eating carbs. Okay, I'm not going to reinforce that. I'm not going to say good on that one. Okay, it's going to come back to haunt you on that. Always does. Always does. Okay. Yes, you'll eat more if you exercise initially. And yes, you'll eat more if you exercise on a regular basis for a long period. But rest of metabolic rate changes and thermic effect of exercise changes, going to change you so dramatically it won't matter anymore. No one eats like me. Okay, that's also why I'm 225 now. But that being said, I exercise a little bit. If I exercise on a regular basis, it wouldn't matter at all. But I don't. So I'm bigger than I used to be, 175 now to 225. Now more like 18% plus body fat, whereas it used to be more like somewhere in the 5-6% range. Being I was 6 foot 175, 170, 175 as an adult, that's pretty light, right? But if you get doing these behaviors more regularly, that will dwindle. Exercising 20 to 60 minutes a day showed significant difference in food selection and amount. People regularly exercise and don't miss days, they eat better. You don't have to tell them to do it. Okay, just exercising. That's the thing that these studies don't tell you. When someone exercises every single day, they eat better. They just do. Their lifestyle behaviors change. They sleep better. They get to sleep faster. They get more deep sleep. They basically have less health issues as a whole if they don't miss days. Can't do that? Hey, we adjust how we need to. Spot reduction, exercise gadgets, and low versus high intensity activity. First of all, like spot reduction, actually like trying to get fat to go away. How do I get my fat to go away from my bottom of my arms here, or right here in this one location here? The body doesn't do that. The body won't selectively pick an area just because you work the area. I think most of you know that already. But if you try to do work physiologically, try to do crunches or some sort of ab work, abdominal core type work, for the hope you're going to have your abdominal muscles get leaner just because you're working that area, that won't happen. However, just the mere fact you're engaging activity as a whole will cause you to lose fat to some extent. It'll depend upon numerous factors, of course. If you lose fat body weight wise, you lose a little bit everywhere, but you'll tend to store it in certain areas more than others. Those will be the last areas would get benefit. Okay. That said, exercise gadgets. There are things that you can put on you like electrodes. There are things that you can actually, little toys you can play with to do different things. Ultimately, if someone's not engaging in significant activity, they're not going to have the metabolic changes necessary to lose the weight and keep it off long term. We want to find some activity that someone is willing to do and enjoys doing, but we also have to be careful with more that short term, whatever it takes to get you going in the first few weeks. That said, as the weeks turn into months, we have to be more consistent about the right kinds of activity, not just, well, you like the elliptical. You love the elliptical. Oh, then do the elliptical right now. You're not doing anything right now? Oh, do your elliptical. Get the time in. Will you do it every day? You will? Okay, do the elliptical. But I would never pick someone to be on the elliptical or something like it for that being their sole time of exercise, or even the predominant form of exercise longer term. It doesn't match the movement skill, motor control, and neuromuscular facilitation type responses we want to be getting. It doesn't get you the compressive forces when you land, so you don't get the benefit to bone density. It doesn't get the connective tissue strengthening that we need from a standpoint of working against the ground for ground reaction forces. It's not going to build any level of reasonable strength over time. It's not going to do the ideal things we want to do from a standpoint of any performance parameters, or have your body not fall apart eventually over time because you have not strengthened everything. Just improving your metabolic rate by engaging in activity is a fantastic start, but what you do with that matters. Okay? And of course, low versus high intensity activity, there's always going to be if you talk to 10 people in the field of either athletic training, not athletic training, with coaching or sports performance or personal training. Someone who's engaged, their primary thing is exercise and conditioning and whatnot, right? 9 out of 10 of them will probably say the best form of exercise is high intensity exercise. And that's just flat out untrue. Couldn't be more untrue. That is a very general statement, a very dangerous statement. If we rephrase that, said, if someone is ready to engage in any kind of exercise, we want to get the best performance gain, get the most out of our exercise. What do we want to make sure that they do at least a couple times during the week? We'd say high intensity exercise, but we don't say high intensity exercise every single session, or that's what everybody should do right now. No one should start there. We start low, we start to engage moderate, low intensity the first few weeks, maybe only a couple weeks. If they're engaging and performing well, we add in some moderate intensity, but get the frequency going first. Get them exercising pretty much every day first before you start worrying about increasing intensity. Then you increase the intensity. Maybe after about 4 or 5 months, we start talking about high intensity. Don't do that, then you're not going to get the proper adaptation connective tissue wise, not going to get the proper adaptation nervous system wise, motor skill wise, not going to get the proper adaptations for hormonal balance. And those things are important. Not just a matter of activity and going. It's a lot more specific than that. So diabetes origins and concerns. If they're type 1 diabetic, person's been obese all their life. Okay, they're insulin dependent. That person's going to have probably pretty much a better understanding of the things that affect them, most likely. They're much more open to the idea of exercise in many ways, recognizing that they are aware of how fluctuations occur. Not always true, but that could be different. Type 2, it's like something is affecting me differently. I don't understand this thing. That people don't want to give up on the things they've been doing all their lives. They've already engaged in bad behaviors for so long. Now the things aren't starting to go their way. They don't want to give up on the things they like to do. The eating poorly, the excessive drinking, those behaviors that affect them and create the more issues more toward obesity and diabetes. Type 2. That is absolutely controllable, and type 2 diabetes can effectively, from a standpoint of symptoms, go away. Okay. There's always a predisposition toward getting anything back. If you've ever been any place in health, any position, obese, underweight, having heart disease or having issues with heart disease or high blood pressure, there's always a greater chance for you than maybe others to get back in that same dangerous place. However, when you are engaging in regular behaviors and engaging the things we've talked about this entire semester on a more consistent basis, which kind of leads us into you designing that project for the untrained person and a person who has some background in fitness or athletic performance, and kind of getting on 2 different tracks for getting them to where they want to be in a year, the best possible training and benefit they can get from a year in exercise perspective. That's a tremendous handbook for anyone to have a better idea of the things they should be doing and the things they should be engaging in on a more regular basis, and understanding how you start and how you progress over time with that 1 to 10% changes weekly, never more, or even daily. Not more like a 1-2% daily, never more than about 10% weekly, right? That said, diabetes can be controlled. Insulin sensitivity can improve. Insulin resistance can decline. And overweight, just like being overweight, can absolutely decline. Sometimes even just losing weight alone with the activity will by itself reduce any issues with insulin resistance, and thus no longer a problem with being overweight or diabetic. That has to be regular though, very consistent every day. Honestly, the research will talk about 40 to 45 minutes or more per day for people who are diabetic, type 2 diabetic or type 1, for better regulation of your insulin response, better insulin sensitivity, and let alone issues with maintaining proper weight and overall well-being. That said, for varicose veins, and by the way, we're covering everything. This is our last lecture video. There'll be no more lecture videos after this. Okay? We'll talk about that more in a second too. Varicose veins, basically, getting proper blood flow, venous return, orthopedic problems with injuries and not be able to move well, circulatory issues. Those are all getting proper blood flow due to proper elasticity of blood vessels and not having more necrotic tissues, where it actually becomes very difficult to get certain blood flow or activity going at all, which happens at least to some extent with age, but it's uncontrollable and some it is. All those are more prevalent to a much greater degree with people who are overweight and obese. Another reason for us to do our best to try to get away from those situations if we can. Adverse psychological reactions. James Corden gave a speech where he was going after another basically talk show host who was saying that we don't need to be getting rid of fat shaming, we need to bring it back. And James Corden, who is a bit overweight himself and still proclaims this, and said, this is the wrong approach. Don't shame people. We don't bring fat shaming back. People who are overweight know they're overweight. They recognize the challenges that are ahead of them. They either don't know what to do, or things are hard and they have a hard time keeping up with things. They don't need to be hearing from anyone that what they're doing is where they are is bad. They know that. And I thought that was a great thing, and possibly if you look up yourself, James Corden's speech on being overweight or obese. I'm sure you can find it on YouTube. I thought he did a great job of talking about the realistic, real life challenges that someone faces when they are overweight for a lengthy period for many years and challenged by that, right? Energy in, energy out. Oh, if only were that simple. It's really not as simple as if you just eat less, you lose weight. That's actually not necessarily true, because you're only talking about the thermic effect of food. That's it. Okay, it's more to it than that. Activity plays a greater role. We talked about that's got the greater role in increasing your metabolism. So there's no question about it. You probably find the point where if you eat less, you're going to lose weight. You have to keep decreasing to some extent. The book talked about, or I should say, our book and other sources have talked about going anywhere between 500 to 1,000 calories below your resting metabolic rate in order to lose weight. Like, well, if you actually take 500 to 1,000 calories below your resting metabolic rate and you're trying to exercise to increase your metabolic rate, which you should be doing, because you don't want to just lower the metabolic rate. That's the whole point. If you eat less, you're going to lower your metabolic rate. But if you exercise also, you are at risk potentially being hypoglycemic, having low blood sugar, and I've seen people do this. They eat such a low calorie diet, sometimes they eat high protein diets, low carb diets, and they try to go exercise. You cannot exercise without carbohydrate if you're going to go into glycolytic type phases of energy production or ATP CP with any regularity, especially glycolytic though, especially glycolytic or high end or aerobic. We're starting to have that crossover time. We're starting to use more RER, so it's going above 0.84, 0.838, 0.84, which is almost nothing. You start using more carb than fat. So your overall performance is going to go down. Someone gets lightheaded easily when they stand up. All signs of low carbohydrate, definitely probably also low hydration. Okay, big roles. Energy in, energy out is not as simple as that unless they're following the whole formula here. Things that affect the resting metabolic rate, things that impact the thermic effect of food, and thermic effect of activity. Okay, but even that does not account for genetics, which is different for everybody. How do we know? Just got to talk it through with the person we're actually dealing with. Lifestyle stress, some things are uncontrollable by us as the expert trying to help someone else who is going through any level of stress and affecting them. Right now is COVID-19 with stress of coronavirus and actually people being confined to their homes. People are eating more. They're having a harder time getting an exercise. They don't want to exercise. They can, but they don't. And they're in close quarters with family, and it's either bringing them closer to their families or causing them more familial stress, maybe a little bit of both, right? But those things are all playing a role with their hormonal balance and thus affecting their ability to possibly either gain or lose weight, right? Psychological, emotional, spiritual factors also significantly challenged right now, either greatly enhanced by the people we're around or potentially greatly challenged by just being the fact we're only around the same people on a regular basis. Even people you care about and like to be around can sometimes cause problems with you being around them more than you ever have before, right? But those kinds of things are things that people go through. This is a unique situation for everybody. But that said, similar situations exist for people at times in their lives when stressors increase dramatically. And then we say, well, eat this, exercise like this, and expect some great result, whereby it's not going to be that way if they have not also dealt with some of these other challenges to some extent. Just like we expect a 1 to 10% change in our exercise, how about a 1 to 10% change on a daily or weekly basis with your nutrition? Don't change everything tomorrow. How about your lifestyle stress? Don't expect all of a sudden you're going to get 9 hours sleep and you get 5 or 4. Go, if you're getting 4, get 4.5 or 4 hours and 15 minutes, right? Small changes. You can't expect, your body is not going to like fat over big changes and expect, your body's not going to expect you to hold it, and it's not going to try to reinforce you too much to hold it simply because it thinks that's not really you, right? And to allow you to also say the same for emotional and spiritual factors, I should say too. If someone's not regular with their communications with people, if they're not really connection with God, if they're not actually doing those things, small connections, little bits here and there, not expecting to change the world overnight, right? But financial, career, job expectations all play a huge role. What's going on in work life? Well, for a lot of people, that's the majority of their day. So consequently, that plays a tremendous difference in how they experience stress. Consequently, the probability of them seeing changes in their weight and their health parameters. But weight loss should not typically expect to be more than 1 to 2 pounds a week. Any more than that's water weight or gastrointestinal bulk. Simple as that. Okay. Anything else beyond 1 to 2 pounds. It'd be amazing to gain 1 pound of muscle per week. That'd be 52 pounds of muscle this year. Being that muscle is a small, very small percentage of overall total body mass, you'd be expecting to gain some intramuscular fat because you gain 52 pounds of muscle. So you probably gain another 15, 20 pounds of fat just to go along with that muscle. Okay. And that's a very broad generalization there. But that being said, somewhere in that realm, and you're storing a bunch more water. You're far more water than you are muscle. You have a bunch of muscle, you're gonna have a lot more water in your body too. So consequently, you're gonna probably store another 50, 100 pounds, 100 plus pounds. So you're gonna gain 150, 200 plus pounds this year for that 52 pounds of muscle. That's not gonna happen. The reality is most people don't gain more than 15, 20 pounds of muscle, maybe 20, 30 pounds if they're doing something freakish for their training sessions, and they probably have great genetic predisposition toward positive response from exercise, right? It's impossible to lose more than 1 pound of muscle or 2 pounds in fat in a week. It's impossible, okay? Rapid loss, rapid return. People who lose it fast, gain it fast. The 6-month rule is a great one. Whatever you're doing, you gotta be able to maintain it for 6 months. More importantly, whatever you're doing, or at least by the 6-month number, so to speak, that's probably when you need to be performing activities and engaging in behaviors that you can maintain for life. Or this program you're on right now is only the temporary you. It's not gonna be the all-time you. Hormone therapy, prescription drugs as necessary by a doctor, and a good doctor will be able to tell you this is not the only thing you should be doing. You should be assuming there's not health risk for something else that we're not aware of. The doctor will determine that. Engaging positive exercise behaviors, activity, better nutrition, and lowering your lifestyle stress and getting better sleep. Okay, those are things that we should be controlling first and foremost, or in addition to taking prescription drugs, if in fact we are doing that based on a doctor's recommendation, right? Hormone therapy, same thing. You have a doctor recommending that, but we want to be seeing specialists or involving ourselves with specialists who see the total person more overall, more effectively, more prevalently, as opposed to just this one factor changing everything. It's more to it than that. So, final thoughts. It's been a difficult few weeks to finish this course, right? It's been difficult for not just the course, you got multiple courses you're taking right now. I understand the challenges that may be presenting for you. I can't imagine that if you're a senior and you've been taken away from your final few weeks of your college experience. I look back at my final few weeks and I can't imagine how difficult that must be for you. I feel for you. Again, if there's anything I can do for you, and now, the next couple weeks that we have before the class officially ends, down the road, if you have questions about anything we've talked about, I don't care if you want to call and challenge me. That's okay. The biggest thing is, one of the things that comes up here and there, you'll hear something years later, so-and-so is talking about you or not. We all hear that in life, not just class and teachers and students, right? And that's the worst. Like, why didn't they bring it to me? They had a concern. That's ridiculous. We as people, and people for each other, and people of God, have a responsibility to help each other and to tell each other when we have challenges, to allow each other to help one another. It's what we do. My whole goal this semester is not to be a teacher to make some money. It's to impart exercise physiology upon you in such a way you can go out there in your lives, fall in this class, not just get a grade in the class and you move on, but you know how to apply some things. You actually have a better understanding of what to do with this information to help yourself and help other people. That's the whole key, okay? To serve God, serve each other, serve yourself with this information. And to me, we should have significant ammunition now to be able to do that. But that is the key, okay? That said, our final things that we have left in front of us: your rough draft due edited. You're editing your classmate's rough draft. You're emailing me and your classmate to show here's the final rough draft so they can see it and they can make their additions. And I know they got it, okay? So I want to know they got it. That's why I want you to email it. to me and them. And they can actually look at that and make some changes before they turn their paper in about a week and a half, right? And then also submit that same edited rough draft that you edited for someone else to on Blackboard. It's in the course assignments. That's your lab grade for the week, last lab essentially, by Wednesday, by midnight. Okay, a couple places are like Tuesday or Wednesday. You got till Wednesday midnight. Okay, and then your final draft of your paper, is due by the 1st of May. Don't take that long if you don't want to. I encourage you, please get it done sooner for your sake. But that being said, do not turn it in any later than Friday 5/1, obviously before midnight. Okay, your final exam, it's not even your final exam, I keep saying that, exam number 3, which is just over chapters, the chapters that we have just been covering the last few weeks. And I'll make sure I'm off the top of my head, I'm losing the number, what number of chapters those are. I want to say it's like 16 to 22. But that being said, maybe it's 15 to 22. Whatever the case is, I will make sure that that is posted. Your exam will be up for you by the end of this week, and you can take it on the 24th on Friday when it becomes available. Multiple choice again, and again, I'm going to give you the questions. Okay? This time you don't have to turn it in. You can just take the questions and make sure you write down some notes for yourself, so when you get to that timed multiple choice exam, you're good to go. Okay? And you'll have that again available by Friday. You got to take it before the following Friday. Okay. Discussion board post for this week will be due by Friday, first post. Okay. And all postings will be due by Sunday, 4/26. That's going to be over obesity and diabetes and talking about those issues. Your final post will be up as well, and you can do it at any time between now and 5/1. It's just you're posting what I've learned. This is your chance to impress me and impress yourself. First of all, impress yourself and impress me. What you've learned. And when you say what you've learned, don't just list things. Not just looking for knowledge and memorization, looking for your understanding of the ability to apply the information. Show me you know how to apply it. I now know that with 46% VO2 max, that's the exercise general range I want to give to someone who's trying to recover from stress on a light day of exercise for them when they're going for 20, 60 minutes. That's where I want them to be. I don't want them to be more than 60%. They might be closer to 40%. Give them some explanation with that, a little bit. That's probably about as much as you need for any given point. But that said, expressing what you've learned so I know you've gotten from it, because that's what I really want to know. I want to know you've improved from this class. You've gotten something from it. That's my grade that I give myself, what you've gotten out of it, right? And as well, you're showing what you've learned, okay? And it's also going to become, along with everything you've done the last recent few weeks, more of a recognition of, okay, when you're at the 87%, 88%, am I going to bump you to that 87% is a little bit much, but 88% going to bump you to the 90, give you an A minus versus B plus, right? Those kinds of things based upon you showing that difference, that factor of difference there. On your final project, of course, as well, which is program design, which is due by Friday, 5/1. You got a couple weeks left for that. And that is a combination of, remember, written and visual. The more visual you can be with it, the better. Charts in particular, charts for sure, right? Having columns and a table, tables or charts, I refer to not charts, tables. Actually, so you can actually define percentages of intensity and frequency and time under tension and type of exercise, recovery, rate of progression, all that kind of stuff, okay? And you're doing it for trained and untrained, and you're breaking it down over the course of 4 different periods, so to speak, of a few months each over the course of a year. Okay, it's meant to be a guidebook or handbook for program design for the trained or untrained in what you now know of exercise physiology. It's been a pleasure. It's my only regret is I can't be able to shake your hand or to talk to you as we finish this class. Again, email, call, questions, concerns, to talk, to be excited, to be upset, anything. Doesn't matter. Just let me know. Okay. Be well. Take care of yourselves. Wish you all the best in everything you go forward. Hopefully, if you're around, we're both around next year. I can see you if you're juniors. If you're seniors, wish you all the best.